You are called to a 30-year-old female who is complaining of chest pain.
All right, so I'm gonna, PPE is on, is my scene safe? Okay, so the nature of illness here is probably going to be cardiovascular, seeing as it's chest pain. Medical control, or dispatch only told me it was one patient. Only one patient. I don't think right now I need any more EMS assistance. And seeing as it is cardiovascular, I'm not gonna worry about stabilization of the spine.
What are you worried about? You're doing great. Keep going.
Thank you. Moving on to my primary assessment, I'm going to form a general impression of the patient. Seems to be in pain and labored breathing with chest pain. I'm going to start my first contact with the patient. Hello, ma'am. How are you doing today?
My chest is killing me.
All right. So with that, I can tell the chief complaint is chest pain. I can also, on the APU scale, it's ×4 because she responded to my voice, as well as I can start with my ABCs, knowing that the airway is open because she spoke to me, showing that the airway is open. I can also assess breathing right now. She is breathing, however, it looks very fast and she looks to be in pain. Moving on to circulation, I'm going to check a pulse here on this hand. Okay, that is fast, and there's no major bleeding as well, but as I feel the pulse, I could also check. Skin condition is warm, pale, cold, and clammy. At this point, I'm going to say that we're going to want to transport right away, as she is showing some bad signs here, maybe of a heart attack. Moving on to my history, starting with the OPQRS occurrence. When did this chest pain start happening?
Like, I don't know, 15 minutes ago.
Does anything make it feel better or worse?
Oh, if I cough, it's so much worse.
Okay.
Other than that, it just, it hurts.
Okay, quality. How would you describe the pain?
It's like somebody just stabbed me in the chest with a knife.
Okay. Region, anywhere else besides the chest?
It's like somebody took the knife and it goes straight through to my back.
Okay. Severity, 0 being nothing, 10 being the worst pain in your life. How would you rate it?
It's got to be like a 10. I have not felt anything this bad before.
Okay. Timing. Has it gotten worse, or has it just been on?
No, it hit and it stayed there.
Okay. Sample. So any other symptoms of chest pain and the breathing?
I'm like lightheaded, dizzy. I'm super nauseous, and my hands are really, really like tingly.
Okay. Any allergies? On any medications?
I have pain medication. I had surgery on my leg like a week ago.
All right.
And then I'm supposed to be giving myself shots, but I don't like them.
Shots for what?
They said I have to have it after my surgery, but I don't like them.
Okay. Any past medical events besides the surgery on your leg? Okay. Last oral intake, what was the last thing you ate or drank?
Probably like 2 hours ago. I had a pop.
Had a pop? Okay. What were you doing before you got this chest pain?
Just sitting here watching TV. It just hit me.
All right. So then moving on to the secondary assessment, it's obviously a cardiovascular issue, so I'm going to probably listen to the heart.
Okay, tones are normal.
Okay. There's probably some other medication I should be giving, but I can't remember off the top of my head. But then, so then after the secondary assessment,
What else could it be for secondary assessment?
What else could it
Do you
be?
think it's just cardiovascular, or could it be something else?
It could be rebound, or could be rebound pain, or pain coming from the gastrointestinal system as referred pain from the gastrointestinal system. So I might palpate the abdomen, see if there's any.
Okay, how do you do that?
Man.
Yep.
To just feel the different quadrants.
No, that one's fine.
It's fine.
Fine. Fine. It's fine.
Okay.
Okay.
Another intervention is as you are short of breath and short partially put this earlier, put on high flow O2.
How? How
Through
do you want to put it?
nasal cannula,
Add?
15 milliliters.
Doesn't work. Takes it off the tree. Why would it take it off the tree? What's the max flow you can have with an ice cannon?
Oh, 10.
Mm-mm.
5?
6.
6. Unfortunate.
Nailed it. Nailed it.
Nailed it. Hey, I'm doing pretty well up to
No, you're good.
Okay.
You're still doing great.
Okay, thank you. Okay, so 6 millimeters a second. So now I'm done with my secondary assessment. I'll move on to reassessment, which I'll start again with my primary assessment.
Something else first.
Before.
Mm-hmm. So you got through kind of what you think it might be, what it's not, what can give you some more information.
About what it could be.
Mm-hmm.
Could I call medical control and ask for there? I mean, I could.
You could if you really wanted to. I'm going to tell you the phone's busy.
Okay.
What do your friends that are trying to help you?
I'll do vitals. Oh.
Yep.
All right, so with my secondary assessment, I would perform vitals, checking your pulse.
Pulse is 124.
Pulse 124, while simultaneously checking breathing after 15 seconds of checking pulse.
So 28, shallow labor.
Okay, so high pulse and short breaths, and then I'll also take a manual blood pressure.
And your blood pressure. We're going to go 104 over 58.
Blood pressure. Okay, so now I move into my
What
reassessment.
else?
Before,
Yep, you missed one vital sign that you're going to want.
so checking pupils.
Mm-hmm.
Glucose.
Well, okay, we can do that. It's 98.
Oxygen saturation.
There you go.
With
So
the pulse and
82.
then- Okay, 82. All right, so now I can move to my reassessment.
If you want.
Okay, moving into my reassessment.
Are you okay with that 82 saturation?
No, but that's why I have you on high.
Do you have me on high flow?
I don't have you on high flow, so I'll put you on high flow oxygen
How?
with a non-rebreather mask,
At?
15 milliliters.
Okay.
So now, looking back at what reassessing repeating the primary assessment, making sure that you're still breathing as you're still talking to me right now. You are, the airway's open, your breaths still seem the same, and I'll check the pulse one more time, making sure that's still there. Same. All right, and then I will look back at my interventions, seeing as nasal cannula didn't work. I went to a non-rebreather mask. I did not do any other interventions, but right now I might, when I put you in the ambulance, I might put you in a position of comfort that would do that to you. And then once we arrive on scene, I want to give a verbal report to the MA.
So en route, we're going to give a report.
Okay, I have a 30-year-old female complaining of chest pain, high pulse rate, low breathing and a low blood pressure, or shallow breathing and a low blood pressure.
You're good. You're good. Slow down.
Probably a cardiovascular issue.
Why?
Because of the chest pain and the low blood pressure, but it also could be a gastrointestinal issue because of rebound referred pain. What?
What else is in your chest
Yeah.
besides your heart?
Oh, the lungs. Okay.
Okay.
It could also be that with a pulmonary embolism. That could be it.
Okay.
But it also could be respiratory issues because of
You're okay. Talk through it.
so it could also respiratory issues because of the chest pain could be signs of pulmonary embolism, seeing as the blood clot would cause pain, and also the shortness of breath would also show signs of that.
Okay, so what can you do to verify that that's the path you want to go down?
I could listen.
Okay.
Also take chest sounds.
Okay, what would you expect to hear if it was a PE?
This is weird.
You're fine. Is there a problem with the lung itself with a PE?
No.
So what would you expect?
Normal.
Mm-hmm.
Okay.
Absolutely.
All right.
So, breast sounds are clear and equal bilaterally.
Okay. And I think that's all I'm gonna do.
Okay, so you talked about what you think it is. Now talk more about what I told you.
Oh, right, right.
Recent history.
The patient told me that she was watching TV when this happened. She had leg surgery a few days before, was on pain medications for it. She was also on some type of shot she did not know, and I did not have access to it, that she had not been taking.
That's going to be more than enough information for them.
Okay,
Yeah.
sounds good.
So you can describe the pain a little bit more
Okay.
if you want to.
Yeah, the pain was a stabbing pain, like somebody had stuck a knife into her chest.
Where at?
In the chest on the right side, on the patient, yeah.
Okay. Okay. So how long till you're there? What's your ETA?
I don't know,
Pick it.
5 minutes. 5 minutes.
Perfect.
Okay,
All right. So now what?
I'm done.
Do you want to reassess?
Recess again.
How
I'll take
often?
vitals. I'll take vitals every 5 minutes because you seem to be in critical because of pulmonary embolism. Could be, you know.
You're feeling impression of pulmonary embolism.
Yeah.
Okay. Perfect. What do you guys think? There's power. Okay. All right. So, what were my risk factors?
What do you mean, like what's?
What makes sense for pulmonary embolus?
The pressure of the leg.
Okay.
The fact that it was pain in the chest, but also there was no lung sounds.
The lung sounds were normal.
Lung sounds were
So
normal.
if this was more of a cardiac event, you could have normal, but what is going to lead you more towards cardiac? What sound? One sound. Your heart's not working right, and so fluid's going to start
So it's
backing
gonna be
up.
wet.
It's going to be wet, so it crackles. Absolutely. Okay? Because you're going to have that fluid
Yeah.
settling back. So we're actually messing with the circulatory system before the lungs, so we're not even getting blood there.
Yeah.
So it's going to start backing up other ways if it does back up.
Okay.
Okay? So I had the surgery on the leg.
Mm-hmm.
Okay? So that already makes me prone to clots. The shot that I'm supposed to be taking is a blood thinner. But people don't like doing the shots in their stomach. They don't have to. So more often than not, they'll say, yeah, no, I don't really want to. Plus, I'm also sedentary because I'm not moving around because I have the leg. So there's a chance that blood is pooling. So leading to that clot.
Yeah.
Okay? So a difference between MI chest pain and PE chest pain. With an MI, how would I describe it?
Pressure.
Pressure.
Like somebody's-
It's crushing, like somebody's
crushing.
sitting on your chest, absolutely. And it's more kind of all over, spread out, can go up into the jaw, can go into the arm, can go into the back, can go into the epigastric area. It just kind of depends on what nerve tract it's irritated. If I'm talking about a PE, it's where the clot is. So it's here, but it's more localized. So a question to help discern is, okay, so you're having pain. If you had to cover your pain up, would it take a hand or a finger? Or does it go other places than that? Because if it's more, yeah, you can get, depending on how it is, you can get a little bit more spread out pain, but it's not going to be as spread out as it is with an MI. Because the MI problem is ischemia in more of an area.
Yeah.
Because we're affecting the body systemically. When we're talking about a PE, it's more this area is not getting oxygen.
Okay.
Okay? What was with the tingling of my fingers? Do you remember what that's called?
I don't remember what it's called.
It's like that circulation.
Perfusion.
Yep, poor perfusion, so it's called carpal pedal spasm. Anybody that is hypoxic has the possibility of doing that. So it actually starts as tingling, and then what they can actually get is their fingers will start like clawing. And they're like, I can't straighten my fingers. People that have hyperventilatory syndrome do that a lot. They'll actually hyperventilate to the point of their fingers spasming, And they're like, there's something wrong with my hand, which makes them breathe even faster. It's not a great thing, and so then the brain resets by making you hit the ground.
Yeah.
So, what are some other things that it could have been? You could have checked for secondary. I would say anybody. Did we look at the leg to make sure it wasn't infected?
I did not.
So that's, and if you don't think it's an infection, maybe you don't check it.
Yeah.
But, so what would be signs and symptoms of infection?
Fever.
Fever, okay?
Yeah.
Chills,
Chills,
clammy skin, or like moisture skin.
yep, and it could be, I mean, the blood pressure was kind of on the little bit lower end, but not terrible. What would you expect the leg to look like? Like, you probably can't look at the exact incisions, but what would you expect the leg above it to look like?
Paler, right?
Go the other way.
Redder.
Yep, so what happens when we injure ourselves?
They send more blood for the
It sends more blood so that things get fixed, right? Absolutely. So instead of blood shunting away, which is what makes you pale, it's going to bring more blood to the area, so you're going to end up getting warm because you have all that heat that's in your blood, and you're going to have all those blood cells there, which is going to make the skin flushed.
You can see
So
swelling. also.
swelling because of all the fluid.
Especially
Yep.
after sun doesn't have room to swell down that leg, so it comes up.
So what's going to come up? Absolutely. You guys are getting this more than you think you are. This is some high level stuff. Doing a great job.
Thank you.
Okay? So, other questions, comments, concerns?
I think so.
Yeah?
Vitals is a good one too. Like, when you say vitals, get everything. Even if you don't be like, yeah, what's our temperature? Sure, why not? Like, you know, get,
Okay.
like, literally,
Yeah.
get glucose, why not? Like, it can all give you clues.
Oh, seriously, everybody that we started an IV on, they're getting a glucose check.
Yeah,
That's
absolutely.
just,
Absolutely. Just,
do
you know,
90%
yeah.
of them need it? No.
They're not gonna knock you, be like, well, you didn't need a fever, so guess what, you're not an EMT now. Like, no. No, but it's a good thing, no, so you said she had an infection,
Oh,
and she does have a fever. Oh, hey, maybe she, you know.
That's one thing that we forget all the time. I don't know how many times we're like, where's the thermometer in this rig? Like,
Back of your hand.
I should probably, yeah, exactly. There's a lot of that. Don't you feel a little warm?
So in the grand scheme of things, are you really trying to get like an exact number? No. Or are they too hot or are they too cold? Like,
Yeah.
The chills is a good one. So, yeah.
You nailed it.
Thank
You did, yeah, you did very
pass
well.
that. You did pass that, absolutely.
Oh, yeah, I did pass it.
Except for the vitals, but I also.
But you know what though? But if you didn't take it, but you're treating appropriately,
Okay.
It's not a critical fail.
it's not a critical
Oh,
fail.
well, if you look at that,
It's not. So it might get you on points, but yeah. And normally people will get to the radio report and they're like, current vitals are, I didn't take them. So we're gonna take a set of vitals here really quick and then I'll let you know what the numbers are.
Okay.
And that happens every year.
Okay.
So seriously though, the people that fail stations, this generally isn't it. It's the most intimidating for you guys, but it's not. The most commonly failed, KED, splinting, long backboard, and oxygen.
Really?
Oxygen because you forget to put on your PPE and check for scene safety before you end up putting the regulator on.
Wow.
That one gets everybody. And then checking for CMS before and after are the other three. And then for KED, it's forgetting to verbalize movement to a long backboard for transport.
Take off the straps.
Oh, yeah.
That got me. Take off the left leg straps.
Oh, yeah.
Wait, what?
Or you don't get them tight enough.
Yeah.
Because after you guys walk out of the room, we actually have whoever's in the KED go like this and move around, and if there's too much movement, you get a critical fail.
Same with the
So-
backboard, you dump them, and if they fall off, then it's, yeah, like you do it.
So you gotta make sure they're legit tight.
Okay. You said taking off the leg straps?
So when you lay down, have a sec. Okay, so you start out here and you put those leg straps on and you put them on super tight because you don't want them moving around. That's what's keeping them from falling out the bottom of the device. But when you go to lay them down,
Oh.
Their legs are stuck like this, they're like, ow.
So it's not something that we.
I can't feel my toes.
We don't do it, we verbalize it though.
Yes, no,
So
you won't
what
actually,
is
it's just a
that?
verbalization. So
Gotcha.
I'm gonna move to the long backboard, I would loosen the leg straps, and then I would check CMS again. Because you move them, you have them in one splint, so you check before, you check after you put them in that splint, and then when you put them on the long backboard, that's a full body splint. So you gotta check again.
Yeah.
I don't think the third check is a critical fail though.
No, I
it's
think I did
just
like
before and
6.
after. Oh yeah,
I'm just like,
I'm just gonna check the
when I
pulse
get stuck,
again.
I'm just gonna do CMS again. Let's-
Can you squeeze my fingers?
6 or 7 times.
Yeah, well then you don't forget it.
Can't get me on that.
Absolutely, I am not failing for this. It's true.
Is that what you need from us?
Anybody else wanna go?
Oh.
Oh,
If you're doing this again next time,
Yeah, maybe
I'll do
next
it then, but like, this time I'm not quite as
Can I try
comfortable.
going through it with my notes, just to like.
With what?
With my notes, just to get more
No.
idea?
but you can play.
Okay, I kinda wanna try it, just so I have
Okay,
like
good.
a base.
All right, so
We'll not use support.
I'm gonna take this off.
Okay.
I'm gonna do a different
I'm gonna
scenario. Yeah, no, you do. You guys can come back.
Oh, that was a prop. Her shoes right down here.
Yeah.
I'm not gonna lie, when I first walked in here, I was like, what happened to her leg? Completely.
So what has happened was, all right, I'm not gonna put my shoe on because I'm gonna put that back on. So you just got it.
You got it.
Okay. All right, so you are called to a 32-year-old female who's complaining of abdominal pain.
Okay.
Okay?
BSI, is this seem safe?
You excited?
Okay. So I would say this is a medical call, and medical control told me I have one patient, and I would not take into consideration I would need to immobilize her spine because it's a medical thing, and she hasn't experienced any trauma. And then
You're good.
And
Deep
then
breaths,
I
deep breaths.
would stay here, and I don't think I would need to request immediate backup at this time. So first, contact with the patient. Hello, ma'am. How are you today?
My stomach is killing me.
Okay. So your stomach is your main problem. Is there anything else that's the matter?
No, I mean, I'm nauseous. It just, it hurts so bad.
Okay. General impression of the patient is she is in a lot of pain, but it doesn't seem to be super critical yet at this point. So then I would assess the ABCs. How's the airway? She's talking to me, so she's breathing properly. Never mind. Pulse is
Rapid and strong.
rapid and strong, and she's breathing and ventilating properly.
I can't take a deep breath.
Okay, you have shortness of breath, so then at that point I would administer oxygen.
How?
Right now the nasal cannula to see how she does at
At
6
what?
mils. And then if she needs more, I could add that with another breather mask. So when did this pain start?
I don't know, maybe 45 minutes ago or so. It started and then it would go away and then it hit again and it'd go away and now it's just constant.
Okay. Is there anything that makes it better or worse?
No, not right now.
How would you describe it? Is it stabbing, throbbing?
Just very sharp. It's stabbing. It's
In
like
the,
right here and then it goes like straight to my back. It's like somebody pushed a spear
Okay.
just through my stomach, but
Is
my shoulder kind of hurts too.
is it
It's really
radiating
good.
to the back, or is it just everywhere fixed?
I don't know. I'm having a hard time like thinking or describing it just because
Okay.
I
And you said it lasted for 45 minutes? So far?
It's been going. I mean, it started and then it would go away and then it started and it would go away and then now it just doesn't go away. It just stays.
Do you have any other symptoms?
I'm really nauseous.
Okay. Do you have any allergies?
Mm-mm.
How about any medications that you've been taking?
I take prenatal vitamins.
Okay. Are you pregnant?
I am, yeah. I'm about 12 weeks.
Okay. When was your last oral intake? What did you eat?
I had like some pizza and wings probably about an hour and a half ago.
Okay. And then, what's the pee sample? Oh, do you have any past medical things that I should know about? Any surgeries or has everything been healthy with your pregnancy so far?
Yeah.
Okay.
I just had my first ultrasound and they said everything looks good.
Okay. And you said you're having your pain right here?
Yeah, right here.
Okay. So then I would begin my secondary assessment by palpating the abdomen to feel for any other pain.
Okay.
So right here, does that hurt? Okay, how about right here? Right here? Right here? Okay, and you said it hurts in your back? Does it hurt right here?
Not so much when you press.
Okay.
It just hurts.
Does it feel better when I press?
No.
Okay, so just right here. Okay. So then I would check vitals.
Okay.
So blood pressure,
138 over 86.
so that's high. And then it could do pulse again.
Okay, so 124 rapid strong.
Okay. Okay, assessing your breathing.
Yeah. So respiratory rate is 24, slightly shallow.
Okay, and then I would get your glucose,
Glucose.
just in case. Right?
Yeah, glucose will go with 112.
Okay. And then your temp.
Temp is 99.
Okay. So a little bit of a fever, but not significant enough. So then I would reassess.
Yep, what do you think's going on?
I would say something with the pregnancy, the severe, or it could be appendicitis,
Where's your appendix?
right here, but it's up. So probably more to do with the pregnancy than with appendicitis. Well, because it radiates to the back. Doesn't appendicitis radiate to the back? No?
It can, but not.
It could be GI tract, or
Okay.
yeah, it could be something with intestinal as well. So that would either be the pregnancy reproductive system or the GI tract.
Okay.
Okay, so then I would say that we have a 32-year-old female that is 12 weeks pregnant and presenting with severe abdominal pain in the upper right quadrant, and it's radiating to the back. She has a little bit of a rapid pulse and a high blood pressure, but her temp is fairly normal, and her breathing is rapid. But is the nasal cannula helping you? Okay, so then I wouldn't probably go to a higher rate if she feels like that's helping her. And then I would reassess all of your vitals. Probably, it doesn't seem to be too severe yet, so I
What
would,
number is it at?
I forgot to rate your pain. That's the one I forgot. On a scale of 1 to 10, how would you rate your pain?
It's probably like an 8.
An 8. Okay, so then it would be severe. So I would reassess every 5 minutes to make sure that everything stays good and steady. And then
What's your
we
field
would-
impression?
final impression,
Your field impression.
like what I think you have. Pregnancy.
What are you thinking, friends? What are you thinking?
What do you think?
Appendicitis because I went to her shoulder. Really?
No.
Huh.
That's what I thought it was. She said something about her shoulder, so.
Yeah. Could it be That's the right shoulder, so it's not by the heart. Could it be pulmonary?
It could be.
Because of the shoulder pain.
Could be.
Circulatory. That's
You
not
guys have
right.
any
You guys have
thoughts?
You've stumped me.
Okay. Okay, so let's talk about what's in the right upper quadrant.
Okay. That would be liver.
Yep.
Not the spleen.
Not this way, spleens over here.
Some of the intestines.
Some of the intestines, what else? What's in the front?
Stomach.
Nope, it's over here.
What's
What's associated
gallbladder?
with the liver? Yes.
So
Gallbladder.
could it be gallstones? Okay.
Okay, so gallstones. So what are the risk factors for gallstones?
Being pregnant.
Being pregnant, being a girl, high fat content meal. Yep,
Okay.
those are huge risk factors. So when would the pain start?
What do you mean?
Like when I got that initial hit of pain, what would you expect that to follow?
When the gallstone has gotten like stuck somewhere.
Okay? You guys have more information? After eating a fatty meal, because that's what the gallbladder does. So it's a storage container for bile, which helps dissolve fats in our diet. So about 30, 45 minutes after you eat,
Okay.
your gallbladder starts contracting to push that bile out. Well, if the duct gets blocked by a gallstone, by a spasm, by the narrowing of that, now all of a sudden you get pain, and then your body's like, oh, hold on, we'll give it a second. And then it contracts again, and then pretty soon it starts spasming.
Okay.
And that's the constant pain.
Okay.
So.
So gallstones.
So
That would be my general impression. Like I wouldn't diagnose it, but that would be what I would suspect.
Yep, absolutely. So, do you need to know what it is?
No.
No, not at all. But well, it appears to be something with GI tract. I'm not sure what it is, but I know it's not heart attack because of this. I know it's not appendicitis because of where the pain is located.
Okay. Okay. Sounds good.
No, you did just fine.
Okay.
You did.
How do we know it's not appendicitis?
So,
up here.
where's your appendix?
Down.
Lower.
Lower. Okay, so the pain starts peri-umbilical first, when it first starts, and then it'll actually migrate, and there's an area called McBurney's Point, which we don't teach it as that much anymore. But if you make a triangle from here to here to here down to your groin, it's right in the center of that. You press, and it hurts, but when you let go, it goes, you're like, oh, it's called rebound tenderness.
Could you, I know that a test for appendicitis is like if they can jump.
So,
Would
yeah.
you test that with a patient?
So you can have it jump, but it's because when you jump, that starts to move. What's even easier is actually just have them stick their leg out and tap their heel.
Okay.
Because that'll still send that shock wave up there. And you're like, ah.
Okay.
What was it with your shoulder? Because you were doing the thing in the room and your shoulder correlated to something.
Gallbladder. Right shoulder is gallbladder. Left shoulder is spleen. They run along those nerve tracks. It goes straight up.
I just feel there's some synapses.
Yeah.
There definitely are some synapses. Look at you. Perfect word. Excellent. Somebody else want to go? I'm good. Oh, no.
I don't remember like.
I messed up. I forgot to rate her pain on a scale of 1 to 10.
I
You have something to go off.
All right.
I couldn't do it, man.
Was there anything that you think I should, like, the biggest things I should work on?
I think you did good.
Would you have passed me?
Absolutely.
Okay. Will they ask us, like, all those questions, like what you did at the end?
No.
Okay.
That's just me so that I can help you guys start thinking above the I don't know, it was this, so that's what I went with. It was more just getting you thinking into that mindset, getting to those differentials. As an EMT, when you're first starting out, you're like, differ what?
Yeah.
And so it's hard
Yeah.
to figure that out. But then starting to be like, well, no, because this is a sign and symptom of this. That's why, that doesn't make sense.
Okay.
It's more just me talking with you guys, pushing you.
Okay.
All right, one of you is going, so pick a number between 1 and 3.
First, why do you start with the nasal cane? Just because it's easier?
So if your patient is not necessarily having a problem with their breathing, do you have to put them on oxygen? No. For comfort, a lot of times, you'll put them on oxygen.
Okay.
So it's very psychosomatic. It helps them feel like you're doing something, and that is probably one of the biggest pain relievers, is that, oh, somebody's here, they're gonna save me.
Yeah.
So now all of a sudden I feel better. Oxygen also helps with nausea. So if you give them a little bit of oxygen, that may subside their nausea a little bit.
Should I have mentioned something like about your skin appearance? Because I forgot to do that
Necessarily.
anywhere. Okay.
Not necessarily. You're gonna report the vitals, so.
Okay. Sounds good.
Okay, pick a number.
Because it's not that
Can I do it? If you do an
Pick a
easy
number.
one?
7.
1 to 3.
I wasn't paying attention.
bad.
3. So I'm 1.
It's 2. Come on.
bad.
Let's go.
You're gonna do great.
I'll go next.
You're fine. You've got friends to help you.
Yeah, you just phone a friend.
They're gonna do.
know how to start this.
Hey, push your people.
BSI is my scene to flip it over. Okay, so you are called to a 34-year-old female who is having weakness. Weakness.
Okay, is this a BSI scene safe?
BSI, your scene is safe.
Okay.
Talk about your scene. There's 5 things you want to know. What do you want to know?
So I have one patient,
One patient?
and her chief, do I go to the chief complaint?
State her illness. So I'll hit on this one.
She complained of weakness.
Okay.
I don't need any more assistance.
Okay.
I can handle this. What else is there? Norwegian?
Did you say Norwegian?
No, Norwegian.
Oh, no. Do you need C-spine?
Oh, no, you don't. Well, as of right now, you don't.
Okay.
I will
Fair enough.
investigate.
Okay. So now do an assessment from the door of me.
Okay.
Introduce yourself.
Okay.
So you can say, my general impression, I have
Okay,
a 32-year-old sitting upright in a chair. Do I appear to be in significant distress?
No,
Not really.
okay.
Okay.
So this is where I come in. Talk to me. Okay, so I'm Johanna. I'm going to help you out best I can today. So, where are you feeling? What is your chief complaint? Like, what's the chief complaint? What is what do you feel is wrong with you?
Oh, so, I don't know, my legs, they're not working.
Okay. Is it just your legs? Like,
Yeah.
is it just all your legs? Both of them?
Yeah, both of my legs.
Okay.
Okay, so what do you know? You're doing your primary assessment while you're getting the chief complaint. So what do you already know about my primary?
The region.
Okay, so what do you test for primary? 3 letters.
Oh, ABC.
Okay, all right, so because you asked me and we're talking,
Yes,
what do you
your
already know?
airway is fine, because I'm talking to you.
Okay.
Breathing, you look like you're breathing fine to me. Circulation.
It says you find it.
Hmm?
It says you find it.
Oh,
You find it.
okay, so it's normal?
Try right there. Got it?
Mm-hmm.
So, feel awkward or out? No. Okay. What else you wanna know about circulation?
CMS.
There's no major bleeds. And my skin, how does my skin look?
Normal.
Pink, warm, and dry. Okay. So you got through your primary. Did you find anything that you suspect is life-threatening right now?
Mm-mm.
Okay, so do you want to stay and get more information, or do you want to load
Yes,
and run to the
I'll stay
hospital?
here.
Okay, so transport, so I'm gonna go ahead and delay transport. Okay, so,
Now I move to like
history.
history. Okay, so how long has this been occurring?
Yep, so when did this start?
When did this start?
So, I don't know, I haven't been feeling well for the last couple of days, but like last night, when I was thinking about going to bed, like my feet were just really tingly, you know, like the pins and needles feeling? Okay, so that's how it was last night, and then this morning I went to get up and get out of bed, and my legs gave out on me.
Okay.
And I managed to get myself up into this chair, but I just, like, I really can't stand.
Okay, so you would describe it as the pain is tingly.
Well, and now,
in your
like,
legs.
it's, yeah, and it's not my feet anymore, like, it's clear up into here, that's
Can you
tingly.
describe? It's just tingly.
It's just tingly, like pins and needles, like when your foot falls asleep, you know that feeling?
Mhm.
Yeah, so it started in my feet last night, and now it's right in my legs.
Okay, so the region is the legs. And started in the feet, went to the legs.
House of the Years.
How would you rate this from 1
Like like pain?
to 10? Yeah.
It's really not, I mean, it's more annoying, I'd say maybe a 2, just because I don't like it.
And how long has this lasted?
I don't know, I guess it's been in my legs right here ever since I have gotten up. It kind of just progressed its way up.
Okay.
Sample.
I don't know where. Okay, what was your last, last
Yes.
one? Eight.
Start with S and actually spell out sample with S.
Is that the sign?
Yep. Absolutely. There's nothing else, like literally it's just that my legs won't work.
A. It's not ill, right?
I already did that one.
Oh, yeah. Oh, okay. Okay, do you have any allergies?
Mm-mm.
Have you been taking medications?
I just, like, I normally don't, but I've been taking like some cold and flu medication over the last couple of days. I've been all stuffy.
Please pee the. Oh, whoops. Has there been any like past medical history I should know?
I'm normally pretty healthy.
Okay. What was your last food intake or?
I had lunch. I slept in this morning, so I guess it was brunch, but.
Okay. And then have you just been sitting here for a while, like?
Yeah, I managed to get into the chair, I don't know, probably half hour ago, and I just figured that I just needed to get blood flow to my legs, and it would be
So
fine.
what were you
but
doing before?
I was sleeping, like I slept in this morning.
Okay. Now I just like try to figure it out, like.
What do you think it could be? Or what do you need to assess to get more information
The vital signs, or
before that? Where's the problem at?
the legs.
Okay.
So like I feel it.
Okay. Good, we're good, we're friends.
Okay, so you can.
Do you feel anything? Not really, it feels really weird. Really weird.
Really not weird.
I don't feel that at all.
Can you anything toes?
Am I doing it?
No.
I'm trying.
Can you feel this?
Mm-mm.
How tell if this like.
That's weird.
feels the same.
Yeah, it feels, I can feel that.
Can you go on your chest?
Yeah.
Can you feel
Am I?
that? No.
Mm-mm.
I think I had, so do I say like, what, okay, has something to do with like the nervous system?
Okay.
Maybe, or maybe not getting the blood down there, so the circulatory.
Okay, what could you check?
Your vital signs now?
Check vital signs, but specifically to the legs. What could you check to see about blood flow? Two things. You can do a pedal or a tibialis pulse, or you can do, and you don't have to do it, but you could do a cap refill on the toe.
Okay.
My toenails are painted for once.
Then I would do oxygen.
Okay, so O2 stat is 98.
Okay, that looks good. Then I would do pulse.
Pulse is 120.
That's a little bit high. Then I would do the glucose.
Glucose is 98.
Okay. Then blood pressure.
Blood pressure is 128 over 80.
Okay. Then this is like when I wrap it up, or
So you're going to want to give a report to somebody about what's going on.
okay. So I have a 32-year-old female who's complaining of weakness in the legs. When I like felt her legs, she said they were tingling, and she didn't move her toes, and she couldn't really feel it. Her pulse rate is a little high at 120, but her blood pressure looks good.
Okay. Anything else about something that I told you that might be important for them to know? Been sick for the last couple
Oh,
days.
yeah.
Yep, and taken some cold medicine.
Okay. Okay. She is taking cold medicine.
Okay. Is there anything else that you think it could be that could affect the movement of my legs? Anybody else have any ideas of anything that you would want to do?
Would you need to, because it could be something nervous, would you want to check for spinal immobilization in case it could be something with that?
Yep, so what would you want to know?
If you can stand up.
I'm going down if I stand up. But what could be an indicator if something was wrong? Do I have low back pain? Any recent trauma? No. It's good. What else could be nervous that could affect the ability? You can check my eyes. They're equal and reactive, appropriate for life conditions.
Can I do, well, I don't know if you do this, but like the thing that you like hit the.
Reflexes?
Yeah.
Doesn't work.
Okay.
Yeah, you could do it.
Okay.
So you check my reflexes, I don't have any.
What was everything that had been done to this point again?
So we did palpation and CMS in the feet. Did reflexes. Patellar tendon reflexes were not present. We're not standing me up because we don't want to pick me up off the floor. We talked about the possibility of back injury, but I have no back pain, no recent trauma, except for the knees giving out.
Was the pulse in the lower extremity strong?
Yes.
How long has this been happening?
It started with tingling in my feet last night, And then now this morning, my legs are extremely weak. I can't stand with them, and the tingling is up here, and I have no sensation.
Could be a clot.
Could be a clot. What would you expect in a clot?
Pain.
Pain. Okay. Would you expect it to be bilaterally?
No.
Mm-mm. It could, I mean,
It-
if I was
Breathe.
extremely unlucky, yeah, it could be. But what's the caveat? Why would it not be a clot?
Because you like pulse.
Because I have a good, strong pulse.
Oh.
Absolutely, so it couldn't be a clot. There's nothing wrong with going down that path just to make sure you're not missing something.
Did you check your foot pulse? Did that do anything?
It was there. It was strong. Anything else with the nervous system that you'd want to check?
So you check CMS or
Can you move your arms?
responsiveness in the feet if they can feel which toes is what.
I couldn't.
Can you move your arms?
So I have more function in my arms. Okay. Field impression, what do you think it is?
I don't know, the nerves are just not working.
Okay, so something to do with the nervous system of
Yeah.
the feet. Okay, how often would you reassess?
Well, I'd probably check, I don't know, at least a pulse, like every 5 minutes. I don't
Okay.
know.
No, every 5 I think is
It's
absolutely
already
appropriate. Okay, excellent. You guys ever heard of Guillain-Barré?
Yeah.
What? Of what?
Guillain-Barré.
I've
So-
only heard of
What is
it.
that?
You've never heard of it?
No, I've only heard of it. I don't know what it is.
you don't know what it is. Okay.
I've heard of it.
I feel like we went over it. So Guillain-Barré, it's truly not understood. We tend to think it's more of an autoimmune type disease, but it starts with progressive weakness and loss of sensation and function. It starts at your feet and it starts working its way up. So the tingling that I had in my feet that's now in my legs and it's moving up bilaterally, right now, not a huge problem. But what happens if it gets up here?
Diaphragm.
Diaphragm. What does the diaphragm control?
Breathing.
Breathing. So I'm 100% with it. I know what's going on, but now all of a sudden the muscle that completely controls 90% of my breathing is not working. So I'm going to try and use muscles here, muscles in between the ribs to try and breathe because I've lost that main muscle.
So
So now all of a sudden I don't breathe. We don't know how far up it's going to progress. We don't know when it gets better. They give you steroids. They'll do a lot of airway control. There's no real, yes, this is what's causing it. Oftentimes people that have these symptoms have a mild cold, something that starts before, and they do think that that's a component. But everything else is normal except for sensation and motor.
does it go from inferior to superior, or does it
Always.
always?
Always inferior to superior.
Okay, and it doesn't follow the spinal cord. Does it follow like the spinal nerves? Or what I'm trying to say is, like, for instance, you said breathing.
Mm-hmm.
Like the nerve that controls breathing is pretty up high. So does it go by where like the nerves come out, or is it the muscles itself?
So it's a good question. So oftentimes it's the synaptic junctions
Okay.
are not firing.
Okay.
So it's not controlling, like your control, like you said, the control center is clear up here.
Yeah.
Yep. For that, do you remember what nerve it was? That controls the diaphragm.
C4-5 diaphragm alive.
You got it. That works. So it's the vagus nerve, or the phrenic nerve. Excuse me, phrenic nerve.
Oh my god.
Hey, no, that's
Yeah.
legitimate. So
Yeah.
it's the phrenic nerve. Okay. So, hey, he's got it going on, guys. But yeah, so, and it has nothing to do with the problem being up here. The problem is down here, where it actually is connecting into the diaphragm itself.
Okay.
So, yeah, no, your brain is going in hyperdrive trying to send signals, but it's not actually hitting that target and doing anything to it. So this is typically pretty long-term care. People, they don't know when it's going to subside. They don't know how much it's going to subside. Some people do have lasting effects. Others have none. That's why, what are some of the questions they ask you when you go to get a shot?
Yeah, have you had any past allergies?
Any past allergies to the shot? And have you ever had Guillain-Barré? Because we don't want to spur your immune system if you've already had this malfunction prior.
Yesterday when I got my flu shot.
I
They
haven't
just
been
asked
asked
me
about
about
it.
allergies.
But it might have been on your forms rather than just.
Yeah. Flu shot they're not as worried about, but like your polio, tetanus, diphtheria, MMR, all of those, have you ever had Guillain-Barré? Or they'll look through your chart and they're like,
That's how I respond.
I've never had one. Yeah. Yeah. So, did you necessarily need to know exactly what was wrong with me? Mm-mm. You checked all the things that could have been fatal, and you're taking me somewhere where they can really do testing and figure it out. So.